How ERCP is performed. Local anesthetic spray may be applied as a spray to your throat to numb the gagging. Your vital signs closely monitored throughout the procedure. The procedure may be short or lengthy depending on the complexity of the case. A mouth tube used to protect your teeth and endoscope. The ERCP scope will be inserted into the mouth, pass through the esophagus into the stomach and do a dynamic insufflated to the standard duodenum and allow visualization. Once the scope is in the duodenum, the major papilla is located. It's important to know the secretion from both the pancreas and bile duct jointly drained into the duodenum through the major papilla. A guide wire and catheter are inserted through the opening of papilla to gain an access to the pancreatic or bile duct depending on where the disease lies. Using fluoroscopy, which is combination of an X-ray machine, guide wire and contrast dye injected by a catheter, the desired duct can be labeled and the doctor is able to identify the problem and provide treatment. If a stone is identified either in pancreas or biliary tree, it can be removed by cutting the sphincter muscle within the major papilla. This is called sphincterotomy. The stone is removed by pulling it out of the duct and into the small bowl using the balloon to sweep and clean the duct. It can then pass out safely with the stool. If a blockage or suspicious tissue is observed, a sample can be observed and sent to the lab for analysis. In the pancreatic duct, when fluid collection stones and structures are present, a stent will be inserted to bypass the obstruction or to drain the fluid. Once the obstruction is bypassed, the normal flow can be re-established. In the bile duct, tumor causes blockage and requires drainage. A metal stent if malignant disease, or plastic stent if it is unknown. If it is obstruction or malignant, can be used to bypass the blockage and re-establishes the flow into the duodenum.